could just join in. Hi, everyone. My name is Anya. I am the co-founder of Active Circle. Thank you so much for joining us today. For those of you guys who don't know, Active Circle is a 501(c)(3) nonprofit with the creative communities. We're excited to be hosting this diabetes with webinar with Dr. Akshit. Dr. Akshit has over a decade of experience in the field of medicine with an MBBS and MBA in healthcare management, and he has expertise in the lifestyle medicine. We will now hand it over to Dr. Akshit. Thank you.
Hi, good evening, everybody. Can you hear me, see me?
You look good.
Yeah, we can hear you.
Okay, great. Okay, so I'm just going to share my screen. Yeah. Everybody can see the screen?
Yeah, we can see it.
Okay, great. So we have we are waiting for more people to join, or we can start?
I guess you can start. People will just join in as the meeting is.
Okay. All right. So today we're going to be talking about diabetes, prevention, uh, can you reverse diabetes? Can you get off medications? We'll touch upon a few of these points, but everybody must understand what is diabetes. And today I want to really talk about what is pre-diabetes. Okay. So I'll just quickly take you through the slides. Slides are only because it's an online thing. Otherwise, I don't really like to use too many slides also. All right. So what is diabetes? So it's a metabolic disorder characterized by chronic hyperglycemia. Hyperglycemia, chronic means long term, and hyperglycemia means increase in your sugar levels. Okay. Due to the absolute or relative deficiency of insulin. So you have your pancreas. Pancreas has something called as beta cells. Beta cells are the ones which release insulin, which is a hormone which is responsible for reducing the sugar levels in the blood. Okay. Oh, obviously, so when you're talking about deficiency, it means there's absolutely no insulin which is getting formed, or there is some insulin which is getting formed which is less, or we have all heard of something called as insulin resistance, which means that you have enough insulins, but for some reason it is not getting utilized properly. Okay, so just to help everybody kind of get an easier overview, okay, imagine this is a cell, all right, a muscle cell, for example, okay. To utilize this cell requires energy. To get energy, it requires sugar, food, nutrition. So to enter it has to open, and all the sugar has to enter the cell instead of staying in the blood. So what happens is you release insulin. Okay. So sounds simple, right? So you imagine khul gaya, darwaza khul gaya, it goes inside, it gets utilized. Okay. But the problem is that the door has a big lock on it. Okay. So what is the key? You have to open it with the key, right? So the insulin is the key to open that lock. So when your pancreas releases insulin, it goes and opens up the lock, it opens the door, and then the sugar goes inside. When this process is kind of affected, then you're going towards something called as diabetes. All right. What are the types of diabetes? Type 1. Let's talk about type 1. Type 1 means there's absolutely no insulin getting formed in the body. Okay, so you have to take insulin from outside. It's mostly an autoimmune condition. Okay, autoimmune means your body is creating problems for yourself. Okay, type 2 is what is the most commonest that we see, and predominantly either you don't have enough insulin which is formed, it's there, but it's not enough, or what I just explained is the insulin resistance. That means you're making insulin, enough insulin is there, but the key and the lock are not fitting each other. And that is why your locks don't
I don't
open.
think so. He's capital K, capital W.
The insulin gets wasted, but also the sugar remains in the blood, pushing you towards diabetes. So that is insulin resistance, which pushes you towards type 2 diabetes. Okay. Gestational diabetes means it's a form of type 2 only, but it means that a woman got diabetes only during pregnancy. All right. Otherwise, it's not gestational. Secondary diabetes means a person got diabetes because of a reason, like someone had an accident, the pancreas got hurt, or someone has been on a very long term 20, 25, 50 years of steroids. Yeah, then you can get pushed into secondary diabetes. Okay. Last but not the least is pre-diabetes. Now, we must focus on something called as pre-diabetes. Pre-diabetes means that your sugars are high, but they are not high enough to be called diabetes. Okay, so just to make you guys understand, we have fasting blood sugar, we have postprandial blood sugar, which means sugars checked after 2 hours after any major meal, breakfast, lunch, or dinner. After 2 hours, when you check your sugars, okay. Then you have your HbA1c, which is your glycosylated hemoglobin, which is your sugar average in 3 months. Okay, so if your fasting has to be normal, it has to be below 100. If it's going above 100 but below 126, then you can be in the pre-diabetic range. Okay. If your postprandial is below 140, that's normal. But if it goes above 140 towards 200, that's pre-diabetes. Anything over 200 is frank diabetes, proper diabetes. Okay. And HbA1c 5.7 to 6.4 is pre-diabetes. Below 5.7 is normal, and above 6.4 is frank diabetes. Now, whether you start medication or not at these levels is a different thing, but you're just understanding how to diagnose diabetes. Now, of course, one level you get at 126, you can't say that you're a diabetic or a pre-diabetic. If you're getting repeat values or the HbA1c starts going up, yeah, then you need to understand that you need to take charge and you need to reverse it. Now, when I say reverse it, why I want you to reverse pre-diabetes is because if you reverse your pre-diabetes, then you can prevent diabetes. So the whole point of even the challenge that we're coming up with, the whole point of the challenge is that one, if you are in the pre-diabetic range, let's reverse it so that you are preventing diabetes. And if you are in the diabetic range, then let's start reducing your sugar levels so that we can start either prevent medications, you might not need medications ever, or if you are on medications, then we can reduce the number of medications that you're taking. Okay. That's the whole point of even the challenge. Who must prevent diabetes? Obviously, everybody should prevent diabetes. Why not? But anybody who has a very strong family history of diabetes must be extra careful. Anybody with PCOD, PCOS, anybody who is overweight going towards obesity must be careful. Anybody who has insulin resistance, anybody who has fatty liver, even if it's grade 1, you need to be careful. Okay. Anybody who's on long-term steroid treatment, these are all risk factors that we need to be careful about. Who can possibly reverse diabetes? Now, I'll just take you to through this slide very quickly. Anybody who's been diagnosed with diabetes, not pre-diabetes, this is diabetes, okay, for less than 5 years of duration. Diabetes who can start changes early and sometimes right medicines early too. So there are a bunch of medicines which you can start early, or there are times where you need to start insulin early so that you can save the action of the pancreas. Okay. So a lot of people resist medication and then they end up with long-term problems. Short-term, everything looks okay, but long-term problems because you have depleted your insulin and we can't really do anything about that. When we talk about reversal of diabetes, we say that your pancreatic beta cells are sleeping. So what we are trying to do is we are trying to wake them up and see if they can make insulin by themselves. That's the whole intention of reversal. Okay. Have been on fewer medications. More medications you're on, harder to reverse the diabetes. Harder means it's a little slower because we have to taper the medicines very, very slowly. We cannot just suddenly say, okay, sari dawaiyan band kar do, which a lot of people do, unfortunately. But at the end of the day, the patient is the one who falls into trouble when you stop all medications suddenly. Okay. Diabetes, which is triggered purely by a poor lifestyle. If there are no other conditions, but purely by a poor lifestyle, if the diabetes is triggered, then it's actually very easy to reverse it. Of course, if the person agrees to correct the lifestyle. Anybody who's willing and ready to make sustainable changes. What is the meaning of sustainable changes? No fat diets, no cutting out complete carbohydrates, no complete ये नहीं खाना वो नहीं खाना वगैरह करके sustain नहीं कर पाओगे. If you can't sustain the changes, then whatever sugars went down, they'll start to come up gradually. Okay. All right. Anybody has any questions on this so far on what is diabetes, diagnosis? Anybody? Great. All right. So what are the pillars of diabetes? When I talk, pillars of lifestyle. So first is, why are we talking about lifestyle? Because lifestyle is the key. When we talk about diabetes, especially type 2 or pre-diabetes for that matter, lifestyle is something that can help you reverse it very easily. Okay. Lifestyle means what you do every day. What is your routine every day? What are a bunch of habits strung together? And when they're repeated over and over again, that makes your routine, or repeated over and over again, makes your lifestyle. So, आपकी रोज की आदतें is a formation of your lifestyle. Okay. So what are the pillars of your lifestyle? So first is nutrition. What you eat, why you eat, when you eat, all of that comes into nutrition. Hydration is obviously how much water, when you drink the water, all of that. Exercise and movement. I'll break it down in detail also so that you all know what needs to be done from a diabetes and a pre-diabetes perspective. Okay. So second is exercise and movement. You have to exercise about 30-40 minutes a day, whether you're going for a brisk walk, whether you're weight training, whether you're doing some cardio, functional training, whatever you decide to do, yoga, but it has to be done. And movement means the amount of movement you do through the day, your step count through the day. That is your non-exercise steps कितने होते हैं, वो भी बहुत जरूरी होता है. Okay. Then what is your sleep pattern, quality of sleep, what time you're sleeping at night, everything matters because when you sleep is when you recover. So if you're not sleeping properly, then your pancreas, your liver, they don't get the desired rest either. So if you want to reverse anything, be it diabetes, fatty liver, blood pressure, cholesterol, PCOD, whatever you want to talk about reversing, managing properly, minimum medication, you want to concentrate on sleep too. Okay. Stress and emotional health, that's like the big like an umbrella on our head. You don't feel good, so you want to have comfort eating. You don't feel good, so you don't want to go for your walk. So stress is something which we need to be very, very aware of. If you try to run away from stress, you're really headed for trouble because stress is an integral part of all our lives. So all we can do is we can perceive the stress a little differently so that we can manage it a little better. Okay, so don't try to avoid it or run away, or it's not going to work. Okay. Addictions. Okay, we have the obvious addictions like smoking, alcohol, drugs, vaping, all of that. But we have some non-obvious addictions also: tea, coffee, biscuits, and of course we have something like scrolling, which is a huge, huge problem now, and taking away most of our time from the things that we actually supposed to do. Okay. And the last pillar is medicine. So it's very simple: medicines and monitoring. If you have diabetes and you're on medication, it must be taken at the right time without missing doses. If you have diabetes, you want to make sure you're monitoring your levels, because even if you say, I want to reduce medications, you still have to know what your sugar levels are. If I say, okay, I will reduce your metformin and I will stop your medicine, but if you don't tell me what your sugar levels are, then you're headed for trouble. So medicines and monitoring is an important part of your lifestyle. Okay, so let's break down the nutrition. All right. So it's not only what you're eating, but how you're eating, why you're eating, and when you're eating. Okay. When you talk about diabetes or when you talk about pre-diabetes, okay, this rule will remain the same. The first most important thing is you have to eat a balanced meal. Now, what you call is a balanced meal? I'm not talking about anything except balancing your meal. So when you're talking about ghar ka khana, bahar ka khana, whatever you choose to eat, but it needs to be in balance. What is the meaning of balance? All your meals must have fiber, proteins, carbohydrates, and fats. Okay. All the four macros need to be in your same plate. Now, fat is very easy because you have oil, ghee, butter that we use in our cooking already. So, ऊपर से extra डालने की जरूरत नहीं है. Okay. So, if your oil, if you want to know how much it is, it's half a liter per person per month. So, oil, ghee, butter. So, if you're a family of four, every month you should have enough within 2 liters. If you're going above 2 liters, 2.5 liters, then that's a little extra oil, ghee, butter that you're using. Okay. Second is fiber. Now, fiber is all your vegetables except potato, sweet potato, and your arbi. These will come under carbs. Okay. Carbs is not the problem. The problem is that we don't have enough fiber. And sometimes now we have started increasing proteins, but otherwise, as a traditional diet, our protein intake, especially a vegetarian diet, is on the lower side. Now, I'm not saying that non-veg is the right way to go either. Absolutely not. But even from a vegetarian perspective, we can get enough protein from your diet instead of popping ourselves with protein bars and protein powders. Okay. So let's say it's a plate. You take at least 3 to 4. Okay. Let's take it to give you 4 katoris. Okay. 2 katoris may you have to have fiber. Now, an ideal plate will be a bowl of salad. It could be sauteed vegetables or a bowl of salad or a bowl of soup along with a cooked sabji. जैसे भिंडी हो गई, कॉलीफ्लावर हो गए, पत्ता गोभी हो गई, whatever you decide to have, आपके फाइबर हो गया, ठीक है. फिर 1 कटोरी जैसे राजमा हो गए, छोले हो गए, हमस हो गया, ऑल द दाल हो गई, पनीर हो गया, लिटिल बिट ऑफ सोया हो गया, or a bowl of curd is there. This will be of vegetarian sources of proteins basically. If you're a vegan, obviously you can't have any sources of milk. So वो तो सारा निकल जाता है फिर उसमें से. Okay. And then the last portion is your carbohydrates. So एक बोल चावल हो गए, दो रोटी हो गई. Now whether you decide to do wheat, whether you decide to do jowar, khapli wheat, bajra, quinoa, buckwheat, your choice. But the only time you start restricting items is if you have stomach issues. So if you have gases, bloating, constipation, diarrhea, acidity, acid reflux. So if people ask me, okay, wheat, should I leave all wheat? If I want to reverse diabetes, should I stop wheat? No. I have myself put people back on wheat because when we check the sugar, especially on the glucometer or the CGMS device, we realize that wheat for this person is actually not bad. But out of a fad, everybody just gone gluten free. So you need to find out. If you tell me कि मेरे को wheat से constipation होती है या bloating होती है, all right, then wheat is probably not for you. But if you tell me no, wheat is actually okay for me, then please don't completely stop wheat. Okay, please check your sugars after jowar. Please check your sugars after bajra. One millet that I would restrict from my side would be ragi. Okay, anybody who's overdoing ragi and is a diabetic or a pre-diabetic, you must check your sugar levels after 2 hours of eating ragi, because most of my patients, including me, have noticed that the sugar levels goes much higher as a compared to a jowar or a wheat or a besan or something. So check your sugars after ragi. But whatever carb you decide to eat, if you're balancing it with your fiber and your proteins, then your sugar spikes will be much lesser. Got it? The why I want to, so when you eat, your sugars go up, either go up like this and drop like this, or they go up and plateau and then they come down. Why we prefer a plateau? Because the amount of insulin that is used in a plateau is lesser as compared to in a spike. And that is why the balancing of the meals will be much better. Okay. Never eat fruit with any cooked meats. Please do not mix any form of fruit. This is irrespective of whether you have diabetes, pre-diabetes, or nothing. Okay. As a general rule, please avoid fruit with cooked meals. All right. You want to eat, it has to be a minimum of 1 hour before or after, still acceptable, but otherwise not to eat with the meals. No fruit juices, no fruit milkshakes, no fruit smoothies. You're free to have vegetable juices, vegetable smoothies, no problem. But do not mix any fruit in your juices. So, for example, there is an ABC juice, apple, beetroot, carrot, not good. You remove the A, you want to change it, you make it an ABCD juice if you want. You can put amla, beetroot, carrot, and the D, if you want a little bit of sweetness, which is coming from the apple, then you can add 1 or 2 dates. But please don't use a fruit in the juicing, in the juice basically. Okay, no juicing any fruits. All right. Then you have so let's say खाना तो this is your balanced meal. So you say breakfast, lunch, and dinner हो गया आपका, ठीक है? Then munching in between. So there is a concept which everybody should learn about. It's called fasting between meals. We've heard of intermittent fasting. We've heard of dry fasting. Very good. But what I'm talking about today is fasting between meals. We have this culture के टेबल पे कुछ पड़ा था, खा लिया. There's no hunger. आँख से सामने दिख गया खाना तो कुछ खा लिया. Now, that is one of the worst things that you're doing, because every time you're eating, you're wasting insulin. Every time you're eating, you're wasting insulin. So, essentially, what you need to do, you eat your meals properly. If I have to characterize your meals as a generic, I'll say breakfast khalo, lunch khalo, halka sa evening snack khalo. Don't have a very huge evening snack, and do an early dinner. And if you're doing a very early dinner, like 6 o'clock and all, then you probably don't even need a evening snack. Okay. Be prepared for the snack that you require. No munching unnecessarily. If there are kids that who need to study late, okay, then you don't eat dinner at 6 p.m. You in fact eat dinner at about 8:30. And then worst case, if you need something, then roasted makhanas or roasted chanas, which are self-roasted at home, that you can use, and we don't use too much of packaged foods basically. And how does this habit get better? The amount of your grocery shopping, what comes into the house, makes a huge difference. If you buy biscuits into the house, someone is going to eat that. Okay. So you change the grocery list which comes into the house so that everybody in the house has lesser temptations. People like me, I'm quite, I love bakery, biscuits and cakes and everything. So the easiest way to do it is to buy less. We don't get family packs at home anymore. Yesterday we went for ice cream, we got 5 scoops separate. That's it. We didn't get that entire family pack. Okay. So we start thinking, making simpler decisions so that घर के अंदर जो है, then everybody starts abiding by that. Okay. Then there are some superfoods. Now, superfoods are important, but you have to understand that you are starting it by yourself, but you cannot keep taking it. So, for example, methi seeds, bindi ka pani, cinnamon water, okay? There are things like apple cider vinegar and all of that. But if you, one is we normally, things like apple cider, at least you should not start by yourself because कभी दांतों में तकलीफ, sensitivity, potassium up down हो सकता है. So we need to be careful with superfoods. But जो घरेलू नुस्खे, even if you're doing, whatever you do it for roughly about 2, maybe 3 months. Okay, if it's working for you, okay, probably you can extend by another month. But if the sugars are not coming down, then don't keep taking it. It's not going to help you. Okay, so please be extremely careful with the superfoods that you're introducing for yourself. If you're under the guidance of a doctor or a nutritionist, no problem. ठीक है, that's a different thing. But आप खुद करोगे तो आपको careful रहना है. ठीक है, करेले का juice and all fine, you can do it, but assess yourself whether it's working or not. And yeah, if you start something, at least continue for 1, maybe 2 months. वो इतने जल्दी आपको result नहीं मिलेगा because these are all natural stuff, so it takes a little time. Okay, oil intake is all right. So okay, so adequate water intake. Okay, so please do not overhydrate either. Okay, we need roughly about 2 to 3 liters for almost everybody over here. You will not require anything more than that, definitely nothing less than that either. If your sodium levels are on the lower side and all, then please be careful. This is more important for senior citizens. Okay, please do not pump them up with unnecessary water. Okay, drink water in the first half of the day. शाम तक जितना पीना वगैरह करो. Then after dinner, start tapering it off towards bedtime. There is no rule to have a glass of milk, a glass of water, especially at bedtime. Please stop these habits right away. Okay, जितना पानी पीना है, जितनी दवाई खानी है, थोड़ा थोड़ा सिप करके ले लिया, that's it. But don't break the habit of feeling thirsty at night. If you start drinking more water in the first half, the thirst will be in the first half, and you'll feel less thirsty in the second half. This is also very important because diabetes can throw a symptom of night urination. You have more urination in the night, which will further disturb your sleep. So if this is already happening to you, please be extra careful with your liquid intake, especially after dinner. All right. Fasting between meals with supplements. Okay, so supplements is completely a different category. On the challenge and all, also we don't really use supplements because it's not generic. Okay. Now, whether you talk about berberine, whether you talk about gymnana, you talk about cinnamon supplements, you talk about green coffee, chromium, okay, these are all supplements which are there for prediabetes and diabetes. They're available. There's magnesium. But again, do not self-supplement. Okay, if you are someone who loves supplements, who believes in supplements, then please get in touch with the right expert so that they can give you the supplements that are required. Okay, only two supplements that I'm very, very particular about. One is vitamin D. Okay, I know in the US it's not easy to get your numbers checked, but once a year, please get your vitamin D and your vitamin B12 tested. All right, whatever numbers come, you will probably require a supplement for vitamin D and B12. So please take it. Vitamin D is protective of all your cells, and B12 is very protective of your nerves. So anybody with diabetes, you have to protect your nerves. Anybody with the medicine called metformin, it can cause a little depletion of B12. So please make sure that you're taking the right supplement. Okay, vitamin D, you will not get enough from sunlight. If you want enough from sunlight, then you have to be in the sun with exposed skin between 10 and 3 p.m. 10 a.m. to 3 p.m., not your early morning sun. Your early morning sun will give you some vitamin D, but it's not enough. Okay, and you need to be in the sun for 45 minutes every day. So if you're in the sun for 45 minutes between 10 and 3, you get enough vitamin D for one day. All right. So please don't depend on the sun or mushrooms or egg yolks for vitamin D. You will require a supplement. Probably 1,000 to 2,000 IU per day is enough. But if you're deficient, then you need a higher dose to correct the deficiency and then maintain it. Okay. Vitamin B12 is there in non-veg, milk and milk products, and a little bit in the nuts and seeds, not too much. So anybody who's a vegan here, not having any milk and milk products, probably are already deficient in your B12. Get it checked. And if you're, let's say below 350, the range will go from 200 to 900. But if you're below 350, then you require a supplement. If you're above 350, then maintain it. You don't require any supplementation. Okay. Any questions on this? All
Hey,
right.
Akshat, there is a question here.
Yeah.
So, what is the fasting time between the meals? Like if
Okay. So
my day
roughly,
starts at
yeah.
9 a.m.,
Sorry.
if my day starts at 9 a.m., I have my breakfast at 9.
Yeah.
So, what
You're
should be
waking up
my
at
lunch
what time?
by 7-ish?
Okay. So the first golden rule should be that when you wake up, you
Hmm.
should try and eat at least some nuts and seeds or a fruit within an hour of wake up,
I do
especially if
that.
your breakfast is delayed. So if you're eating your breakfast at 9, I'm very happy even if you don't eat till 12 or 1. So 3 to 4 hours, if you're able to fast, is actually good to bring your baseline sugars and your baseline insulin levels down. If you're in a habit of eating every 2 hours, you're headed for trouble.
Oh, so if I have nuts at 7:30,
Yeah.
so I should be eating at 12, my breakfast.
No. Nuts is separate. That's just
Okay.
an on wake up thing. Your meal is at 9 a.m. So I'm happy if you don't have lunch till 12 or 1.
Okay.
So suppose you say, okay, 12:30 1 तक भूख लग गई, which is good, 4 घंटे हो गए, you eat your lunch, then automatically you are fine till about 4 o'clock, 4 5 o'clock. Then you have a light snack if you require it. If you don't require it, then 6 7 8, wherever you're having your dinner, no problem.
So if my lunch consists of a bowl of dal and a bowl of fiber, and so is it okay to have a glass of watery buttermilk with it?
Yeah, absolutely. Yeah. Buttermilk is not a problem. You can have it at the you can end your meal with the buttermilk, no problem.
Okay. Okay.
Now, suppose you say, I don't want to have the buttermilk with the meal, suppose, and I want to keep it instead of chai, I rather have a buttermilk in the evening, which is fine. You can add a little bit of 1 or 2 tablespoons of sattu ka powder also if you put in that. It's a nice, like a protein shake for the evening. It works really well.
Okay. Because I need 2 cups of tea and 1 cup of coffee in the day, but my none of them have milk and none of them have sugar.
No, it's just an addiction. There's no nutrition coming
Yeah.
from that. You're not getting anything out of it. So my first suggestion is to reduce maximum. Anybody here, either it's tea or coffee, maximum cups in a day has to be 2. The third one is going to start deteriorating your bones. बाकी सब छोड़ दीजिए, but tea and coffee, especially coffee, is something which will start leaching out calcium from the bones. अभी आप उसमें दूध डालो नहीं डालो, चीनी डालो नहीं डालो, that's a different problem. But the amount of addiction that we are developing, whether it's energy, happiness, comfort, whatever you want to call it. So restrict your cups, not mugs, to 2 per day, and you have better replacement. For some time green tea वगैरह ले सकते हो, but eventually you should not have to keep eating, drinking anything. That's the whole intention basically. This is something which will help you protect your teeth. नहीं तो आगे जाके आजकल डेंटिस्ट वैसे बोल रहे हैं, thanks to everything that we are doing, the teeth are deteriorating faster. So there are a lot of things that we need to work upon. Your gut health. If you keep eating, drinking, except water is different, but if you keep eating, drinking, there's constant peristalsis which is happening in the gut. So anybody with acidity, constipation, bloating, you'll never get better. The fasting between meals is another reason for the improvement of the gut health. So you're giving enough rest to the gut along with good sleep patterns.
Okay. Thank you.
All right. Okay. Then moving on to exercise and movement. So exercise is as good as eating metformin. What do I mean by that? Metformin is your anti-diabetic drug. It's one of the earliest and the best drugs that are used as an early treatment. Okay. Metformin works well because it reduces insulin resistance, means it sensitizes your cells and your insulin so that it opens up faster and the sugar enters faster. Okay. Exercise does the same thing. Now imagine you have such a strong aid for yourself, but the biggest issue is we run away from exercise. We look for motivation for exercise. We can't find time for it. We go on a vacation and we forget about it. Someone falls sick, we forget about it. Our work will always take priority over our exercise. Okay, so if anybody here today is not exercising, I would urge or rather mandate it or force y'all if I must, because y'all are wasting unnecessary time not exercising. Okay. Now you can choose. It could be a minimum you want to look at starting with about 20 to 30 minutes, and you can go maximum to about 60 to maybe 75 minutes also are acceptable in one day. Okay. But you must be minimum 4 to 5 days in a week. Never do 7. 7 every day exercise nahi karna. You need at least one rest day. But on a busy week, don't go down below 4 days a week either. Okay. What is the best or the ideal form of exercise? It's a combination. You have to do some form of cardio, whether it's jogging, running, walking, brisk walking, swimming, cycling, elliptical, whatever you decide to do, jumping jacks, a little bit of functional, all that is one side. And on the other side, you talk about weight training, yoga, Pilates, where you start activating your muscles. Okay. So if you say that what is ideal for me, I say, okay, fine, you do a 3-day walk and a 3-day weight training or a 3-day yoga, you're done. You don't have to do anything more than that. Or you say, okay, I'm going to do 30 minutes of yoga and then I'm going to do like a 20-minute or a 15 minutes walk after that. Yes, that works too. So depending on your schedule, what time you can make for it. But you must chalk out, जैसे खाने का time है, काम का time है, you must chalk out time for exercise. If you don't chalk it out, so like I know for me, I know that my exercise is between like 7:30 and 8:30 or maybe 9. So this is my time which is chalked out for exercise. I'll not take things before that. I'll not take things during this phase so that I do not miss out on exercise. Now, of course, there are exceptions which will happen. Days will change. You're too busy or someone is unwell or you are unwell. Fine. That's a different thing. You didn't work out for a week. Okay, fine. Get back. Don't keep harping upon tomorrow, or I'm looking for motivation. I can't get up in the morning. I can't sleep at night. Leave all these things. Don't overthink. If exercise disturbs your sleep at night, okay, then you can't exercise at late at night or in the evening. But if that's just a psychological block, then please exercise at whatever time you get, because sleep will eventually improve with exercise. Okay. So please pick and choose. If anybody here is not exercising, just do a walk. Basic stretches, shoulder rotation, hip rotation, hands up and down. Basic stretches kariye and start with a basic walk. It could be a 15-minute walk also, and dhire start increasing your pace. Okay. So cardio is something which reduces sugar levels then and there. It starts putting it down. Weight training, yoga and all is something which gives you better regulation through the day. उस टाइम अगर आप चेक करो तो शुगर ड्रॉप नहीं होती है, धीरे धीरे पूरे दिन में आपकी रेगुलेशन बेटर होने लगती है. Okay, so that's the difference between the two forms of exercise. Then you talk about movement. Now, this again, a golden rule that I put for everybody is that non-exercise steps, it should be 5,000. At least reach 5,000, which is non-exercise steps. So what's going to happen if you try this? You will sit less. Every hour, you will be forced to get up from your chair, walk for 2 minutes, use the washroom, walk for 2 minutes, and only then come back. Get up, drink your water, walk a little bit, come back. Find reasons to walk. And fortunately, you guys are in the US, so आपको तो काफी reasons हैं. हम इंडिया में और तरसते रहते हैं कि किधर walk करें. Okay. Then you have a concept of post-meal walks. 30 minutes. Do not walk immediately, but 30 minutes after you finish your meal. Of course, I'm hoping that you all are all slow eaters, none fast eaters. You need to eat your meals a little slowly also, which I forgot to say in the previous slide. But make sure you take about 15 to 20 minutes to finish your meals also. Okay, take smaller bites and do them thoroughly. All right. Anyway, so after you're finished with your meal, you relax for about 30 minutes. When I say relax, please don't lie down. No lying down. You can sit, you can do your work, whatever needs to be done, you can do it. But 30 minutes after that, you walk for 10 minutes. It's a light walk. It's not a brisk walk, but for 10 minutes. And this post-meal walk will help you get your postprandial sugars down. So खाने के बाद sugar बढ़ता है, थोड़ी सी walk कर लो, it will get it down. So it's not a brisk walk. It's not an exercise walk. Please don't try to climb stairs and everything, but it's a light walk. Whatever staircase and all you have to do, you can do it after an hour. Or exercise if you want to do, you can do it after an hour. Okay. Then any diabetic or not so much for the pre-diabetic, but any diabetic must eat something before going for, especially things like weight training and all. Yoga, ठीक है, that's a empty stomach आप कर रहे हो, सिर्फ पानी पी लिया, no problem. या 5 बादाम खा लिया, ठीक है. But anybody who's doing higher intensity workouts and all must have a pre-workout. Now, what is the best pre-workout? Have a fruit with nuts, you're done. Okay, you don't want to have the beetroot juice and all that, for perfectly okay. Okay, please do not depend on coffee as a pre-workout, especially if it's first thing in the morning. If you start your day with tea and coffee, nothing will get better. So you have your water, you have your nuts and seeds, उसके बाद चाय कॉफी पीनी है चलेगा, but don't tell me that I'm having coffee as a pre-workout. That's only detrimental. Okay, post-workout meals, you must have any form of protein after your workout. Now, whether you believe in something called as anabolic window or not, forget all that. But whatever workout you do, if you eat protein post-workout, okay, whether it's within half an hour, within an hour, or suppose you say I'm having breakfast as post-workout, no problem. Just increase your protein intake in your breakfast. Now that protein will be better absorbed. It's not that baki time absorb nahi hota hai, but it is better absorbed into the muscles. Whatever exercise you do, your muscles are activated, so you'll absorb your protein a little better post-workout. Okay, so make sure you have some amount of protein post-workout. All right, reduce sitting time for sure, and increase your step count easily. Okay, any questions on exercise and movement?
I want to know,
Yeah.
you said about the beetroot juice. So is it
Yeah.
okay to have to like the ABC mein the B can be beetroot?
Yeah, B is the beetroot.
It is the beetroot.
Yeah. So A
Even
is
if you
apple.
have-
The original A is apple. Now we've changed it to amla. B is beetroot and C is carrot.
Okay, so even it is okay for pre-diabetic and diabetic?
Yeah, so you can have it nothing to do with diabetes, but even from a kidney stone perspective, 2 times in a week is safe. Don't have it like every day and all of that. No.
Because I
And
have juice every day, but it's like ABC. So I generally put avla, I put carrot, cucumber, dudi, celery, spinach, whatever vegetables I have.
spinach twice a week, nothing more than that. Beetroot twice a week, nothing more than that. Carrot can be taken every day. Kakdi can be taken every day. Celery can be taken every day. Tomato again, 2-3 times. That's it.
And dudi, like
Dudi every day. Yeah, dudi is okay. These are gourd vegetables are actually quite safe. Karela and all, they are very safe, very light. So you can actually take it every day. No problem.
okay.
So I have one question.
Yeah.
This is Rashmi. You said for pre-workout, usually before my hike, I only have a tea with milk and almonds. That's it. So it's not
Yeah.
okay? Why? I want to know why.
Are you a diabetic or a pre-diabetic or
No,
you're
I'm not diabetic. No.
are you pre-diabetic?
No, I'm good. My sugar level is very good.
Okay. So either way, we like to have something called as sustained energy.
Hmm.
When you mix the fruit with the nuts and seeds, it's a beautiful combination for a hike. That's why we have a lot of people have these granola bars and all.
video आए हैं मैं तो खबर नहीं पे ऑडियो हम तो खाली ऑडियो थी
I think everybody else can mute themselves, please.
Yeah. So, okay. So, because I usually do every Friday 9 mile hike, which is a very strenuous hike, but it's been a few years, but I can't eat before my any walk, tell you the truth. And I can't walk after meal either, tell you the truth.
So you're having milk tea.
Yeah.
but
That's
you-
protein
but
enough, right? It's enough, no? I get protein from milk, no?
I mean, how much milk are you putting in that?
I know my tea is very boiled and strong, but with the like India jaise, boil karke.
But I don't need protein pre-workout. I need protein post-workout anyway. But
Yeah.
anyway, I'm not stopping your tea. All
Mm.
that I'm saying is, so what you can do is you have the nuts and the seeds,
Mm.
okay? And you have like 2 dates with that. Don't have a
Okay.
fruit
Okay.
or anjeer or figs or black raisins. So
Okay.
that will also kind of suffice the role of a fruit. And with the tea and everything, then you'll be okay. After the post-workout, after your hike, make sure you have some protein like a sattu shake or something. If you're not doing protein shakes, of course it's okay. But after workout, make sure you eat some.
Yeah, my problem is I don't feel hungry after my workout.
Why is that?
So you help me understand that.
No. So if it's a very strenuous workout, then you can wait half an hour के बाद तो भूख लगनी चाहिए. You should feel hungry after half an hour.
Hmm.
If you don't have to eat immediately, you can shower, relax, whatever you need to do. And then half an hour, 40 minutes, within an hour also, if you eat, it's okay.
Okay.
I'm not saying that you get out and just start to eat. No, that's not what I mean.
Okay.
But relax yourself a little bit because obviously when you're exercising, your stress hormones do increase, which is fine.
Hmm.
And in that increase, sometimes your hunger can get suppressed. But as
Hmm.
you kind of unwind, you just relax, take a shower, then your hunger should start coming back.
Right. Because after 2-3 hours later, I feel hungry, but not
Then
right.
that's- Yeah, that's a big gap.
Okay. So I need,
That's it.
but even if I eat just almonds, that's okay then? Just,
No, almonds, you're doing pre-workout, right? Don't repeat the almonds again.
oh, I should not repeat that again. Okay.
No. About 6 almonds per day enough. Let's not overdo nuts and seeds either. And
Got
again,
it.
nuts and seeds are not for snacking. Everybody, I think everybody tends to use nuts and seeds for snacking. So don't do that. What I would suggest is take a shower and everything and add
Hmm.
just a sattu shake. Okay,
Okay.
that's a nice shake. See how you feel after that. And after that, if 2 hours after that, if you eat your meal, that's fine.
Okay. And one question on juice. So mostly my juice is spinach, orange, strawberries, and no strawberry. You said no. You're nodding.
No fruits. No fruits.
No fruits at all.
No fruits at all. You
Got
cannot
it.
blend fruits. You completely. So there are two problems. One is obviously the liquid sugar. So the spike is higher. But the main problem is actually the disintegration of the fiber.
Hmm.
So it's not a good idea.
Even strawberries are not good.
Absolutely not. No. Berries, strawberries, so-called low glycemic foods. No.
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 Okay. So
No.
I completely mean, how many years I drink this juice? Okay, I need to change my recipe.
Yeah, so I mean, I'm a Punjabi. I've had fruit with meals for the longest time. But when I stopped it is when I saw my bloating go down.
No, this is not with the meal. So
No. I'm just
yeah.
saying my side of the
Right.
story.
Got it.
We were never into fruit juices and all anyway. Even as a child, both my parents are doctors, so we were never given anyway.
Right.
So in that aspect, but now because of the trend that this is, a weight loss or a good energy dense drink and all, smoothies and juices have become huge.
Mm-hmm.
So we need to be extra careful with the fruit juices. Vegetable juices are okay. And if you ever need any sweetness, then use dates, use a little bit of jaggery. Worst case, use a little bit of jaggery. Use raisins. Raisins, especially the black raisins, are safer. Use
Okay.
figs, no problem.
Okay.
Apricot, all these things are okay.
Okay. Thank you.
Hey,
Yeah.
Dr. Akshay, there are some questions on the chat also I'm going to read. Can we
Yeah.
have vegetable juice in between meals?
Yeah, so if you are hungry, no problem. But like I said, if you're on the fasting between meals, then try not to eat. If you're not hungry, then don't do it. If you say, can I make my evening snack? Can I replace my tea with my vegetable juice? That's one of the best things that you'll do for yourself. So mid-morning, evening, absolutely fine, no problem.
Okay, there's another question by Suzanne. I have
Yeah.
heard bitter gourd and melon is good for sugar control. Is it called kugai in Chinese? I am
I
not sure.
wouldn't know about the Chinese part, but if you're talking about Karela, that's bitter gourd,
Yeah.
that's good. Definitely good. You make it a sabzi, you make it a juice and have it, very good. It works pretty well. I mean, very good in the sense that I'm not saying that 200 ka sugar 100 pe aa jata hai, but
Yeah,
your
I
overall
think Suzanne,
sugar
Suzanne does
regulation.
not understand Hindi. Yeah.
Oh, okay. So I'm not saying that your sugars will drop from 200 to 100, but it gives you a better sugar regulation with the meal, basically. So if you're saying bitter gourd is good for sugar levels, yes, it's good. You can have it once a day in a form of juice or a vegetable, no problem.
What's the ideal time for fasting between meals, like for diabetic people? So if
Like
you
I
say
just said,
that
right? It can be 3 to 4 hours.
3 to 4
But
hours.
again, yeah, ideally. But again, this is something that you have to build on. If you're in a habit of eating 2 hours, you'll feel unwell. And anybody who's severely diabetic or you have fluctuating sugars or anybody who's on insulin, you need to be aware of your hunger levels. Now, if you are feeling hungry, you can't keep pushing it to the point where suddenly you're famished and you're eating a lot. So
Okay.
I'm giving you a number of 3 to 4 hours, but like there are times I'm not a diabetic, but I can fast for even 5 hours in between. But I cannot fast beyond 5 hours because as per my metabolism, I am hungry between 4 to 5 hours. So you need to understand hunger levels. You need to understand what meal you have eaten. People stop eating everything. They remove carbohydrates, they remove dals, everything has been stopped, and they're eating salad. Obviously, you're going to feel hungry within 1 or 2 hours. So you need to, my suggestion is first rectify your meals. Make sure you're eating your breakfast, lunch, and dinner properly. And within that frame, start understanding your hunger levels. Then you can do your fasting between meals easily. On the other side, reduce unnecessary munching. कुछ दिख गया वगैरह, आपके फ्रेंड्स कोई आ गए, कलीग्स खा रहे हैं कुछ, तो उन्होंने ऑफर कर लिया तो आपने एक बाइट ले लिया, वो सब, all that you need to stop. That's okay?
Thank you. Yeah, thank you.
All right. Okay, so moving on to sleep. Now, sleep, like I said, is your tool to help you repair. जो आप so-called healing की बात करते हैं, we talk about healing. It all happens when we are sleeping. When we are awake, there's hardly any repair work happening. So if there's a construction thing happening even on your road, on a highway, it mostly happens towards the nights, the wee hours, because the number of cars are lesser. If you try to repair something with the cars, you're going to head up. It's going to take longer to repair it, or it might not get repaired properly. The same way, if you're not sleeping properly, that's a bigger issue. Now, having said that, I'm not going to tell you that you have to sleep with the sunset and you have to wake up with the sunrise. I don't think if anybody wants to do it, I don't stop them from doing it. It's absolutely a beautiful habit, but it's not practical for someone like me. So I don't really push it. What I request or urge people is to get about 7 hours of undisturbed sleep. Now, what this means is I have a lot of mothers specifically who will sleep at 1 o'clock, 12 o'clock, but they'll get up at 5 o'clock just to drop their child. School, they'll drop the child to school and then they will sleep after dropping them for 2 hours again. So they'll say, no, that's 5 + 2. No, that actually, okay, fine. It's a compensatory mechanism. Afternoon naps are compensatory mechanisms. Yes, agreed. But it's not that ideal sleep that we're talking about. So ideally, you want to look at least 7, probably 8. Sometimes 6 hours is very acceptable. Never less than 6. And very, very, above 8 also should be very, very minimal. Below 6 should also be minimal. Okay, hafte mein, mahine mein, probably once or twice in a month, there is an emergency or you're traveling or something, fine. The sleep dropped, no problem. Or one of the weekends you overslept, no problem. But if you find yourself oversleeping or undersleeping more often, then that needs to get corrected. Okay. Then is the quality of your sleep. Quality now, unfortunately, there's so much of hoo-ha about sleep that we use a lot of gadgets. So the first thing is please don't use gadgets for sleeping. Use your gadget for walking, no problem, but don't use it for sleeping at all because these gadgets, I've worked with a gadget company for many years. In fact, right now also I'm a consultant with them and I know for a fact that they do not work accurately. Every flicker, every movement is counted as a drop in your deep sleep. Okay. So please, if you're sleeping well enough, there's not too much of snoring, you're not waking up other people with your snoring and you're sleeping well enough, you don't get up with a gasp of air in the middle of the night, and you're relatively well rested in the morning, then your sleep is fine. Okay. Night urination, obviously once you go for urination in the night, maybe twice, probably your prostate is a little bigger in size or your sugar levels are high, acceptable if you come back in sleep. But obviously if you're drinking more water, that has to get cut off, so your night urination will anyway reduce. Okay. But if these parameters can change, it's very good. Bedtime regime is something very, very necessary. If you continue to scroll on a gadget, whether it's your phone or whether it's a laptop, you will eventually lose the amount of melatonin that you're making because the blue light will hamper it. So we don't have a choice in that. So at least now people say 1 hour before bedtime. Again, if you can't do it, then at least 20 minutes before bedtime, 30 minutes before bedtime, let go of your phone. Okay. Suppose you say, I want to watch something because that gives me sleep. Then you want to watch a television which is far away, that's still acceptable as an alternative. But ideally, we say you journal, you meditate, best is breathing. You do something called as left nostril breathing. You close the right nostril and you breathe from the left side. 5 breaths, 10 breaths, as comfortable with you. Or just do deep breathing where you just take in and you deep breathe out. Okay, you don't want to do breathing, you don't want to do journaling. Talk to your partner. If you don't have a partner, to do a little bit of self-talk, review your day, see what went wrong, what you want to do for the tomorrow. Just plan it a little bit, and then, if required, go into Shavasana. You can just lie down, go into Shavasana. You want to count backwards. You want to say some 5 words. You repeat 5 words again and again. You will fall asleep. Okay. If you can't sleep, don't obsess over it because every time it becomes a pattern. आज मुझे नींद आएगी कि नहीं आएगी, will I get sleep tonight, will I sleep well tonight? These are the things we are reprogramming ourselves to not sleep. All right, so the obsession on the sleep has to reduce, which will actually improve your sleep pattern, your sleep habits, your sleep hygiene. Okay, try to sleep like a fixed bedtime and a wake up. Try when I say this, for me I'll say okay fine, my sleep is between 11 and maximum 12. So I'm very particular. I'll say I will not stay awake beyond 12 in the morning. So 12 a.m. I will not stay awake beyond that because I know that my wake up is between 6 and 6:30. So worst case 12 to 6 is 6 hours. But ideally it's 11:30 to 6:30, which is my almost fixed bedtime. Now it's not exactly fixed, but we need to have some numbers in our head so that we can rotate, revolve around it. Okay. Apart from that, factors affecting sleep. Now, what is it that affects you? A lot of people have a lot of overthinking, a lot of thoughts which come when you go to bed because everything else becomes quiet. So the mind starts to wake up about what's happening inside. Now, such people must put your thoughts down on paper. If you just put your thoughts down on paper, the mind is relaxed and then you can fall asleep easily. Okay. So I always tell people there are two things necessary to fall asleep. One is a little bit physically tired body. So if you exercise, you work your thing, whatever you want to do, very good. And the opposite is the relaxed mind. If your mind is worked up and your body is not worked up, is not like not tired enough, then the sleep becomes a problem. So physically tiredness is not a bad thing, but mental tiredness is a problem. So mentally you must be relaxed for falling asleep easily and not waking up multiple times in the day. Okay. Sleep supplementation, I strongly do not advise it, whether it's melatonin or magnesium. If you really want a sleeping aid, then you have nutmeg tea, you have chamomile tea, all these things are okay. I would strongly not suggest milk in the night either. Once your dinner is done, I think you should again go into a form of fasting only where you're not really eating or drinking anything except a little bit of water here and there. या अगर जीरे का पानी for digestion, jeera water, cumin water if you require from a digestion perspective, okay. But I wouldn't really say any strong liquids after that, okay? If you really require supplementation or medicine for sleep, which is again, if you have insomnia, we can't find a reason, or you've even done a sleep study, okay? So if you've done a sleep study and you have come back with sleep apnea, if you need to use the machine, a CPAP or BiPAP for some time, please go ahead and use it. Because sleep apnea is something which will reduce the amount of oxygen going inside, which will hamper all your recovery. And I know for a fact that it's not for life. If you can make the changes, the sleep apnea machine will also go. Okay. So please understand what is it that is affecting your sleep, because then it's easier to handle. If you can't figure it out, meet an expert. Whether you need supplementation, whether you need medicine, you can take it for a short period, see how much you respond to it, and then we can take you off also. Okay. So I don't condemn anything, but you need to understand the causes also. Okay. Any questions on sleep? All right. Okay, so stress and emotional health. Now, I'm stressed about legal issues, money issues, family issues. I'm not growing. I have too much work. My maid has not come. My parents are unwell. My child is unwell. 101 reasons for stress, and they're all genuine. Now, I'm not going to take away that we don't have problems. Yes, we have problems, but we are going to have problems. So if until unless we accept that, we are never going to be able to go into a sustainable lifestyle. Okay. So whatever problems you have, try to face them head on, try to accept what they are, and then try to find solutions around it. If you try to hide away, if you try to fight it, don't accept it, then it just gets harder to manage it. Okay. Now there are tools. Journaling is a beautiful tool. Meditation is a beautiful tool. Deep breathing is a beautiful tool. You have positive affirmations, visualization, but these will work if you believe that you can manage your stress. If you believe and want to get better, then these things work. Otherwise, you're just creating a burden on yourself. Okay. Meditation, one note on meditation: if someone is already overthinking or someone doesn't like to express, suppression is too much. Meditation is good, but first try to journal. Put your thoughts down, and then if you meditate, you'll actually get a better response and you will be able to meditate for longer. Okay. Meditation can be two types. One is a guided meditation where you're hearing something and they're telling you what needs to be done. Now, this is good for someone who's absolutely distracted. You can't even close your eyes for a minute, 2 minutes. For someone like this, use the guided meditation, but then let go. Remove it. After a few weeks, you should be able to sit in one place 2 minutes, 3 minutes, 5 minutes, 10 minutes, and just meditate, or just don't do anything. If you are able to sit for 10 minutes in a day, not doing anything, no gadgets, nothing close to you, that's a form of meditation too. Because nowadays, we just want to keep doing. So the minute we are able to stop ourselves, you're doing a good job. And all these things, whether it's breathing, whether it's meditation, you can start clubbing it. If you can club it with your exercise, or when you're sitting in a car or in a bus or a metro, or just before bedtime or just after waking up, then it will become like a habit for you, which will kind of precede one, the next. So it's easy for remembering. Of course, anything that you require water reminders, you require meditation reminders, food reminders. You're free to use your apps, you're free to use your reminders. But I mean, like I said, I don't go crazy about apps. So try to reduce the necessity for a phone or a gadget. But initially, if you need it, fine. But then get out of it. Start kind of fitting things in your routine so that it keeps going. Okay. Counseling and therapy is a much, whether, I mean, it's the good part is it's not a taboo anymore and people are accepting it more openly. So if you are someone, who has any form of past trauma, past suppression, there's absolutely no reason for not reaching out for help with the right expert. Now, of course, there are a lot of quacks and a lot of coaches who don't know what they're doing, but a psychologist, a proper counselor, CBT trainers might be a good idea to reach out if it's something that you can't figure out by yourself what's bothering you, but you feel sad or low or depressed or anxious and you can't figure it out, then you can reach out for a trainer or to a psychologist, or you know the problem but you're unable to help yourself, still reach out. That's why I was like, so the best part is you go to a psychologist, you might never require any psychiatric medicines also, which is again not a problem. If you need the medicines, you need it. But if you don't need it, you can help yourself. Now, why is this important? Because these are the factors which will help you keep going. If you don't keep exercising, if you don't keep eating healthy, then obviously your sugar levels will start to go up. Okay. Apart from that, stress by itself, okay, too much of a running around day, too much of every day you're running around, every day you're by the clock, is just increasing your stress hormones. Okay. Now, your stress hormones are known to increase your sugar levels only and only because that's your survival mechanism. You need more sugar, you need better blood supply to function better. You need better nutrition to function better. So don't think that cortisol is your enemy. No, cortisol is not your enemy. Cortisol is one of the most important hormones which makes you do stuff. Okay, so relax yourself, get your work done, and that will help you manage your stress anyway better, which will help you manage your sugar levels better. Any questions on stress, sleep? I think addictions I've already spoken. So smoking, I think
Can you guys mute yourself, please?
Mrs. Mala Chaudhary, I think you are on unmute. Can you mute yourself, please? Thank you. So addictions, obviously terrible. Whether it's smoking is not confined to the lungs. Whether it's your gut health, whether it's your esophageal health, whether it's your kidney health. Okay, it's very, very necessary to protect our kidneys when it comes to diabetes or for that matter pre-diabetes. So smoking is a strict no-no. Alcohol preferably is a no-no, but if you like, a pint of beer or 230 mls with water, no mixers, and you pick and choose what you eat with your alcohol, maybe once in a week, couple of times in the month, it might be acceptable. Unless obviously you have grade 3 fatty liver or fibrosis has started in the liver, then it's a different ballgame altogether. But if you have no problems and if you can learn to moderate your alcohol, it still might be okay. Smoking, strict no. Vaping, absolutely no. Any form of drugs, hookah, completely get off it. Especially the kids also need to understand that vaping is smoking, still carcinogenic, still will cause issues. Okay, so we need to be extra careful. Tea, coffee, I've already spoken about it. Don't you enjoy it, have a cup, have to, don't get dependent on it. One day you don't get tea, you should be too much of headache and all these things should not be. That's actually withdrawal. So if this is happening to you, please be careful. Don't drink tea or coffee just to pass motions. People do this also. People smoke also for motions. People drink tea and coffee for motions too. Okay, so we need to be careful. Sugar, salt, oil. So you have sugary stuff, salty chips, or French fries, everything, fried food. You're free to eat everything you want. But if you're unable to moderate it, then please cut it out completely for a minimum of 3 weeks. If you're able to moderate after that, very good. If you're not able to moderate it, then please you'll have to cut it out completely. Okay. I am a believer of balance and moderation. I do not like the concept of all or none. So what people do is they completely cut themselves off And now Diwali is coming, so they will overeat. So if you're going to do that, then you will not be able to reverse or prevent any form of diabetes, because all or none will cause trouble. Okay. Screen time scrolling, like I said, if you really want you're kind of defending yourself that you're looking at health content or finance content, and that's how you're learning, fine. Then define a period for it, put a cutoff. I myself have an app lock for Instagram, which is 1 hour, and it will lock my app in 1 hour. Of course, I can unlock it. Of course, I can unlock it. But it's a good reminder for me, which says that, hey, you've already been on Instagram for 1 hour. Okay. Now I have to be sensible enough and say that, yeah, so I actually wasted that 1 hour. It was more of scrolling. Or I'll be like, no, I had to post something. I had to make something. I had to, give some advice. And also, I'm okay with this 1 hour, and I will extend it for another hour. But you need to start defining these things for yourself. If you mindlessly keep doing it, especially before bedtime or the first thing in the morning, you're just going to feel unwell. Your posture is going to get ruined. Your eyes are going to get ruined. And again, when it comes to diabetes, you don't want too many aches and pains to further aggravate, and you need to protect your eyes anyway. So scrolling, screen time, be aware. We live in a world of gadgets. We live in a world of technology. So I'm not saying you can't do it. You have to do it. But start kind of defining boundaries for yourself that this is enough. Ab ye bahut ho gaya. Okay. Medicines and monitoring. Anybody is on insulin, anybody is on oral medications. There are 6 types of drugs. You could be on any one of them. Few drugs need to be taken before meals. Few drugs need to be taken after. Whatever it is, your doctor's prescription needs to be followed to the T. Okay. If your sugars are going down, very good. Get back to your doctor and start reducing medication, start reducing your insulin. Don't do it by yourself. If your sugars are going up, you know what needs to be done. Okay. Keep a glucometer with you. Every person with diabetes must have a glucometer in the house, because you must be checking fasting sugars twice a week and postprandial sugars twice a week also. Okay. CGMS is a device which gets attached to your arm, and it stays roughly between 7 to 14 days. There are other CGMS devices coming, but the commonest one is the one which stays for 14 days. It takes your sugar levels every 15 minutes. It's a good device if you put in the effort of writing what you have eaten, because then you can correlate. Chawal say, how much does rice increase my sugar? How much does roti increase my sugar? How much does quinoa increase my sugar? How much does ragi increase my sugar? It's a beautiful way of finding out. Of course, like I said, if you don't want to put the CGMS with the glucometer, you can also do it. All you have to do is prick yourself twice. You prick yourself before starting the meal, and then you prick yourself again 2 hours after finishing the meal. So this will give you your basically glycemic load. So how much did the sugars increase with this meal? And you can start breaking it down for yourself. Okay. Once in a year, you must check your eyes. When it comes to the eyes, it's eye pressure, it's vision, and there's something called as retina. That's the back part of the eye, which is the most problem area when it comes to a uncontrolled diabetic. Okay. Neuropathy is basically tingling, burning sensation in your hands, soles of the feet. There is a way to check it. One is obviously symptomatic, but the best way to check it is once in a year, you get something called as biothesiometry. Now, again, I don't know how easily it's accessible in the US, but in India now, most diabetic clinics, we have this machine. So we make the patients check it once a year. It's basically sensations, vibrations are passed into the toes and the fingers, and we compare the sensitivity to a normal response. Okay, how quickly you respond to those vibrations compared to a normal response. Okay, once in a year, if it's done, it's more than enough, and we compare the yearly reports. Okay, for the kidney, there's something called as a urine protein creatinine ratio. Good idea to do it once in a year. If it's already on the higher side, then you will have to repeat it at least once in 6 months. Okay, it's a urine test. Okay, it's not a blood test. Okay, vaccines. Now, anybody over here above the age of 50, 55, or 60 for sure, a diabetic, must be taking the pneumonia vaccine. I think flu vaccine is compulsory for all of you all, right? But pneumonia vaccine is something which is very, very compulsory for a diabetic. You do not want any form of hardcore pneumonia to happen. It's just harder to recover from it. Okay. And now we have the shingles vaccine, which is again a good idea. My own grandmother got shingles. She's not a diabetic, but it troubled her for almost 2 years. Okay, average people get better even 1 or 2 months also, but for some reason for her, especially because she's I think 80 years old, so she had a huge problem. So if you have the option of taking shingles, so three vaccines basically. Pneumonia is mandatory from my side. Please take it. Anybody who's a diabetic, especially over the age of 55, 60, please don't even think about it. Go get the vaccine. Second is, I think, flu vaccine, which is compulsory for all of you guys. And third is shingles, which can be put out for a discussion with your doctors. I think this is good. Okay, I'll quickly touch upon something called as, this will be my last slide. Okay, we'll quickly touch upon something called as foot hygiene. Now, your feet tell a lot about your health. And when it comes to diabetes, we need to be extra careful about the feet because a lot of times, because of neuropathy, we start to lose sensations. So we get hurt, we don't realize it, it becomes a small ulcer, okay, it becomes a gangrene. Now, I had thought that we had eradicated gangrene, but to my surprise, I last week got a patient from the US who is due for an amputation just because of uncontrolled diabetes. I mean, it's if I go through his routine, the poor man doesn't do anything except work, and he doesn't deserve to have an amputation. But unfortunately, his HbA1c is above 10. His sugars don't come down below 200, 250, 300, and it was ignored. The feet were ignored. So he comes back late, goes out early, all of that. So anybody over here with diabetes, please start checking your feet every day. The way you check your face, you want to start checking your feet. You can use a mirror to check the bottom of the feet. When you put your shoes, when you wear your shoes, make sure there's not a single drop of stone, pebble, pins, nothing in your shoe. You want to check it properly, take out whatever's there, and then wear your shoe, even if it's just the shoe that you wore last night. Okay, something could have fallen inside, so please be careful. Do not use razors and blades to cut your nails. It has to be a nail cutter, and you want to cut your nails straight. Okay, don't make this really deep U, because ingrowth is a big problem with diabetes, and if it happens, right from antibiotics to sometimes pulling the nail out, and a lot of procedures can happen. Okay, so be very careful. It's okay to leave the nail out a little out if required, but don't make a very like a deep U and then promote ingrowth. Okay, so please be careful about that. Anybody's going for pedicure, make sure you test the water with your elbow or your hand, and only then put your feet. Actually, elbow also, because if you have neuropathy in your fingers, it's a big thing. My mother-in-law can just pick up this whole patila and keep it. She doesn't have any. She's a diabetic. It barely feels anything. If I try to do the same thing, it pricks me, it burns me. So diabetics have a lot of issues not understanding what the problems are. Okay, so please be careful about this. Whether when you're in the house also, wear a chappal which has wear slippers which has some support in the back. Otherwise, you'll not realize sometimes the slipper can come out. You will not realize and you can fall. We want to prevent all types of falls. All right. Too much of bare feet walking, be careful. And socks is something which is a choice, no problem. Yeah, and look out for signs of tingling, shooting pain, numbness, and itching. All right. If you have repeated, then you want to make sure you get yourself checked for neuropathy. Sounds good? Any questions on any of the things that we've spoken about? Yeah, I think we've kind of overshot the time as usual. So if there are no questions, then we can end it. Or if there are any questions, I'm happy to take them. But the whole intention is for you guys to start taking care of yourself. If you have diabetes or pre-diabetes or family history of diabetes, no one is spared. So the earlier you start making changes, the better. And the pre-diabetes diabetes challenge that we are coming up with is only and only to help you guys get better. So the intention of the challenge is, if you're a pre-diabetic, we want to reverse it in the next 3 months. Now, of course, if you're above 6.2, 6.3, you might take 6 months, but I can tell you that I have seen my previous pre-diabetes challenge. If you're anywhere between 5.8, 5.9, everybody has reversed it, whoever has participated. Of course, if you come onto the challenge and don't do anything, then there's no point. And the challenge is designed in such a way that I will give you only one habit per week. And the habit is all going to be from everything that I've already told you. It's one of these habits which are going to come every week. So we're going to have roughly about 13 habits which will be given to you one at a time, and you just have to do those habits. I'm going to put out a poll. You'll mark the poll. Once that poll is marked, you know that you're done for the day, so you're accountable. So that's how I will track your progress. If this, I mean, I can assure you that it's not going to be difficult. So if you can put in that effort, and if you say, I want to do it myself, do it. How you do it doesn't matter, but you doing it is what is eventually, because I'm sure most of you knew most of the things that I've told you today. It's not that you didn't know, but it's just that karna, you don't get to doing it sustainably. You do it 1 month, 2 months, and then everything drops. So doing it eventually sustainably is the whole intention of all of this.
Are there any further questions, or we can end the session now?
Thank you so much, Dr. Akshat. Very informative session. I did
Thank
not know. I love my chai, by the way, and I only drink 2 cups of chai, but good to know.
No. Please enjoy your tea. Like I said, I have nothing against tea. My wife is a tea lover herself, but don't get so dependent on it that if you don't get it, then it becomes an addiction. That's the whole
Well,
point.
I am dependent on it. I do get headache if I don't drink, but that's the only addiction I have.
Yeah, so you can probably reduce the quantity to begin with and see if that can reduce, the addiction can reduce. Otherwise, because it's still in moderation, I'm okay.
Yeah. Thank you. Thank you so much.
No problem.
I just have a few words, if we don't have any other questions. First, starting off with thank you, Dr. Akshat, for the session. It was really informative, and I'm sure people learned a lot. Just reiterating what you said. So Active Circle is hosting the 2-month pre-diabetes diabetes challenge with Dr. Akshat, and it's completely run over a WhatsApp group. Like he said, he puts a habit every week, and then you mark it in the poll. There's a fee of $20 per person for doing the challenge, and all the proceeds will be donated to the Johns Hopkins Division of Endocrinology, Diabetes, and Metabolism. To actually register for the challenge and just for more information on it, you can check out the website, theactivecircle.org. I'll put it in the chat as well. We recently hosted a Lose the Bulge challenge with Dr. Akshat earlier this year, and that one was pretty successful. I think almost 60 plus people. So we do hope that today's session opened your eyes and it'll prompt you to joining that challenge if you think it's needed. It's a great way to just improve lifestyle and prevent diseases like diabetes. Thank you guys for joining.
Pre-diabetes and diabetes, yes.
Yeah. Thank you all for joining, and we hope to see you at our future events.
All right. Thank you so much. Thank you. Bye-bye.
Thank you.